very quickly, a lot of people think, when they think about weight gain, they think about food in the main, but this is work that I've done with my former PhD student, Sarah Hind, where we scoped how the popularity and availability and affordability of cars these days leads to multiple impacts on our food consumption and physical activity. As I said, when you're driving in the car, you're exposed to advertising. I talk about screen-based, but in the car, there you see, and on the radio, you're blasted with advertising for food. You have easy access to the plethora of food options. You can eat on the run. And so you're stuffing food in your gob, not thinking about what you're eating. And then there are all these ways in which just driving, chauffeuring the kids has impacts on physical activity. And the net result of this mobility, this key to the mobility system, and I would argue to the industrial diet, is obesity. So what do we have at the moment? We have feeding the cities, the unsustainable paradox of plenty. The term paradox of plenty was coined by an American social historian, Harvey Levenstein, a wonderful book written in the 1980s. And he pointed out then, and it is even more true now, that amongst ample food supplies, and I'll say something more about that in the next slide, food poverty continues. What we call diseases of affluence are appearing, and so alongside, food poverty actually can bring with it coronary heart disease, obesity, diabetes too. It's because if you're poor, you're generally eating energy-dense foods, not nutrient-dense foods. Inequalities within the community grow. Some are eating the healthy foods and some aren't, and that can be for reasons of poverty or availability or acceptability. And citizens are obsessed by dieting and nutrients. Paul Rozan has done a number of studies comparing the American attitude to food and the French attitude to food, and finds that the French, while they're great consumers of laxatives, I'm not sure about where this comes from, they still do view food with pleasure. They say they will eat particular foods because they're pleasurable. They're not concerned about the health-giving or depleting properties of food. But and he's done it's a 4-country study. I think it's Japan, Korea, France, and the US. And he says that those societies that view food with pleasure have the lower BMIs. So this obsession with health, with dieting and nutrients, is not necessarily health promoting. So for me, feeding the cities is more than about ample food supplies, it is about our relationship to food. A really important thing about nutritional inequalities is not the abundance of calories, but I think what we're learning in public health is that the most healthy diets are those diets that are replete with dietary diversity, where people eat across the smorgasbord, but they're diets that are tilted in the direction of high fruit, vegetable, legume and fish diets. nuts. There is some meat in there, there is some dairy, carbohydrates certainly, but now what we're finding in Australia and the United States, which is where I know the figures from best, is that the cost of fruit, vegetables and fish is going up disproportionately to meat, dairy and uncomplex carbohydrates. That these foods are now being priced out of the realm of many households, unless of course they grow in the backyard. And there is a huge gulf about who can afford the dietary diversity that is health protective and who can't afford it. So what I'd like to say in this next slide, links to this, is that the present food crisis, and this was made abundantly clear across the weekend I've just attended on the global food crisis. We had people beamed in from the United States, the United Kingdom, people, lots of foreign affairs and trade officials, your company Fonterra, Zespri fruits, kiwi fruit. Nobody in the 170 wide audience argued that there was not enough food on the planet at the moment. This is a recent slide from the Food and Agriculture Organisation. We have sufficient food to feed every person on the world, but the present food crisis is one of entitlement. It's one of distribution, but it's one of entitlement to that food. That you do have enough money, that you do live in proximity to that dietary diversity I mentioned on the previous slide. Having said there is sufficient food, the looming, and it is upon us, the real food crisis is that food yields are beginning to decline, so there is a limit to the growth of the industrial food supply. And that's slide after slide, when they talked about globally, Australia kept being mentioned. It is just because our cereal production has really plummeted until this last 12 months because of climate change. Climate change also brings new diseases to grains. There's urban encroachment, which I'll say more about in relationship to Western Sydney. There are labour shortages. They are all constraining growing the food supply as we know it in an industrial model. There are distributional issues, incomes, and I'm going to say something about another distributional issue is the corporate control over local food environments. And I'll explain what I mean by that, but there's now good evidence the way large supermarkets really shape what is in the neighbourhood food environment and how that operates and people's access to it. And there is huge crisis, in my opinion, in consumer skills and knowledge. People just are so confused about what is good for them that they turn to the corporate food provider because at least you know that food is safe microbiologically, and you know you're not going to get sick. So I think this consumer skills and knowledge, handing over control to others, is a huge issue.